Hey gang, thanks for tuning in to Travel Nursing with Trace. I'm Trace, and today we're going to talk about advice for new travel nurses. So my first piece of advice is do not interrupt orientation. You're going to find, as I have, that orientation isn't always cut out for you. I'm an operating room nurse, you know, from watching my other videos. Orientation isn't always put out there just for me, and very rarely does it ever apply. My best advice that I can give you is go through the orientation, listen to what they have to say. Basically, what is the presentation about policies and what to do, what not to do, and how to get along, and, harassment and all the basic pieces of information you'd probably hear anywhere. The skill checkoff was for floor nurses, not for the operating room. I felt there was some room for improvement focusing on skill set. So don't interrupt the orientation. Play it cool. The next thing I would say, don't be late to work. Be early. Be an early bird. If you've never been an early bird in your life, be an early bird now, because they are going to be watching you. A lot of facilities will have morning huddles. In my opinion, they don't amount to shit, but it's very important for that hospital to be able to check it off their list and say they did it and they taught you something that morning. All we really want to do is go and take care of our patient. We don't want to come in at 6:30, have to stand in a meeting for 15 minutes when you have a 7 o'clock start, or you have to make rounds at 7 o'clock and you have 15 minutes to get your together and get to it. But they don't see it that way. So don't be late. Be there early. Get dressed into your scrubs if you haven't already gotten there. My next piece of advice is never call in unless you're dying or you're already dead. You're usually on contract for 8 to 13 weeks. You can do this. I can do it. You can do it. We all can do it. Don't miss a day. First of all, if you miss a day, that's a huge chunk of money out of your paycheck that you don't want to lose. Second of all, if you go to work every day and you work every hour and you get there when you're supposed to and you leave when you're supposed to, anything else is overtime. And that's where you really make your money. So don't miss a day. It looks bad on you. It looks bad on your agency. If you're looking for an extension, you're not going to get it because you've already shown that you can't be reliable. Don't miss a day. The next thing I would say is take as much call as you can possibly handle. There are a lot of hospitals that don't require their travelers to take call. I happen to be in on a contract right now where they do expect travelers to take call. Why is that? Because 95% of their staff are travelers, and if they didn't require their travelers to take call, there would be no one there to take call. My point is take call because that's where you make your money. You're going to make twice the amount that you would make regular hours on call. Take a lot of call and then smile all the way to the bank. Make the most of your day off. This is where a lot of people go wrong. This is where I've gone wrong before. Sitting in the dark, damp, dank room of wherever the hell I am, thinking that I'm just going to rest, when in reality what I got was depressed. Make the best of your day off, make the most of your day off, see the sights, and go out and go to a zoo or go to a restaurant that you've never been before and you don't have back home. Get some sunlight, play some sports, go fishing. If you're a writer, write outside. Whatever it is, make the most of your day off, because being cooped up in a hospital all day is not the best for your health. Traveling can be really lonely. You'll miss your family, you'll miss your friends, you'll miss your cat, you'll miss your dog, whatever, you're going to miss them. So find a hobby that you like to do that will keep you busy. Mine is making YouTube videos. There is a lot of work required in YouTube videos. You can spend hours and hours, as I do every week, bringing this kind of content to you so you can learn or you can enjoy it. Speaking of which, if you haven't already, please smash that subscribe button, ring that bell, share this video, like this video, please. I put a lot of work into this video for you, so please, please, please subscribe. It's going to be very important for you to make friends wherever you go. Fake it. If you're not a friendly person, if you're a dry person, if you're reclusive, if you're an introvert, I'm an introvert, but it's very important that when you're out on these contracts, you make friends, you be sociable, you be kind, you be thoughtful. Before I leave work every day, even if I'm getting off at 5 o'clock and it's 5:05, I make sure that I make the rounds to every operating room and I offer my friends a break to get out, just use the restroom whatever. Number one, it builds friendships. Number two, it builds confidence in you as a nurse that you're going to be there for them. If you're not a naturally nice person, that's fine. Just fake it until you're done with your contract, and then you can go right back to being hateful. The next piece of advice I have is you're going to be new. You may not be a new nurse. I get it. You may know your inside and out, but you are new at the facility that you're going to. My advice is for you to take advice. Take advice from those who have worked at that facility for a long time. They know where things are. They're going to be your best buddy when you're in a pinch. Just be nice and shut up. Identify the people that you should stay away from. There are always some. I have the best contract right now, the best contract I could have hoped for in Omaha, Nebraska. My bosses are nice, my doctors are nice, my surgical techs are nice, anesthesia is nice. There are a couple that when I see them coming, I do a complete about face and I walk the other way because I want no part of their bad attitude. I don't ask for advice, I don't ask for help, I don't ask for a joke or a funny dance move. I just get the hell out of Dodge because I know those people aren't good for me, they're not good for my brain space, and I don't want any part of it. So identify the people that you shouldn't ask for help. As a traveling nurse, you're going to find that you're going to be put into places that you may not know the service line or the job that they're asking you to do. It's okay not to know something. You have to learn. Everywhere you go, I'm still learning. Every day I still learn. Ask for help. Don't pretend to know something that you don't. That's very dangerous. Most of you already know this. There are a lot of new travelers coming into the field. There are a lot of new nurses coming into the field right now. A great piece of advice is if you don't know something, don't pretend that you do, because you'll put yourself at risk for your license and you'll put your patient at risk. Don't ever pretend to know something that you don't. Always ask for help. There will be someone there that will be willing to help, especially if you have built a relationship with them. This piece of advice may be the most important. I know it was for me. Take a contract that you want. Don't let someone pressure you into it. Don't let someone, say that you're out of time, you got to pick something, or you should take this job or that job. No. The important thing is that you pick your job. You're the one that's going to have to live it, breathe it, and eat it for 13 weeks. Pick the job that you want and only that you want. That's so important. If you don't, you're going to hate what you're doing. So go somewhere that you want to go and do something that you want to do. It's all about you for that 13 weeks. Send the money home to the wife or the husband or the kids or the dog and the cat, but do something that you want to do so that you enjoy that 13 weeks. Otherwise, you're going to want to cancel the contract. Spend a little extra money on your housing. You've got it. You're going to be making it. Spend it on your housing. I made a mistake when I went to Odessa, Texas and stayed in a hellhole. There's nothing out there but sand and stress and anxiety and depression. Nothing but crap. Sorry, Odessa, it's true. So spend a little bit more money on your housing. Maybe you normally spend $1,000 a month. My recommendation is spend $1,300 a month or $1,500 a month. Yeah, it's money and you're spending it, but let me tell you, there's nothing worse in staying in a place that's uncomfortable. It's got no shower curtain. It's got no cooking utensils. The bed is a futon. There's scorpions crawling across the floor. I've experienced all of this. Spend a little extra money on your housing. You won't regret it. Don't give a about the little things. Stop giving a have no to give, because really the little things aren't what's going to get you through. It's the big thing about taking care of the patient that you're there for. Care about the things that you're supposed to care about. Care about your patient. Care about your family back home. Take care of your patient first and foremost, and you will be okay every day. But don't get bogged down over all the little tiny things, the stress, the red tape, the hospital politics. None of it's important. The only thing that's important is that you know about patient safety. You know how to take care of your patient, and the patient leaves better than they came in. One thing I run into occasionally is people doing things the wrong way. Things that I know that should not be done, and I don't do those things. No matter how I might be feeling pressured, I refuse, because number one, I have a patient that needs me to advocate for them, and number two, I have a license that I'd like to keep. So very, very important. Don't ever feel pressured to do something that you feel is wrong. If you have a gut feeling about something, there's a reason why. Go with it. Don't do something that you know is the wrong thing to do. Question anything that you feel is off and go to your manager and make it known that I have this feeling about this certain thing, and let them look into it. And if you don't get the right answer, go to your agency and let them know what's going on, and stand by your guns. You need to protect your patient first and foremost every time. One great piece of advice is Google the hospital that you're going to be working for prior to taking the contract. You need to know what service lines or what they're asking you to do. If you're going to be working with psych patients, if you're going to be doing brain surgery and you've never done it before, you need to know what's going on. You need to know what they're offering, what they're not offering. Google ahead and know what hospital you're going to be working for before you take that contract. Ask for more money on every contract. When your recruiter calls you and they say, I've got this great job in Omaha, Nebraska, and this is what it pays, hey man, just ask for a little bit more. If you ask for $5 and they give you $2.50, that's $2.50 that you didn't have before. Ask for more money every time. You are valuable. You are needed. They're recruiting you. They want you. You set your price and try to get every dollar that you can. It works. I've done it. And if you're not trying that, then you're really losing out. You're missing money. You're leaving it on the table. Expect to get on. You're a traveling nurse. You're expendable. You're going to be gone in 13 weeks. They don't have to look you in the eye forever. You're going to get the worst call. You're going to get put into the hardest rooms. You're going to get every add-on case that comes their way. You are going to take the brunt of the abuse, and it's because you are a traveler. They don't know you. They're going to use you, and they're going to give you the worst of the worst. Plain and simple. They know you're making the money, and by God, they're going to work you for it. So just expect that. Do not cancel a contract, and do not piss your agency off. Both of those go side by side. I've had contracts before that I absolutely hated, but I kept them. There was only one that I canceled. Odessa, you made the list again. I won't mention the hospital's name out of courtesy and professionalism, but man, oh man, that was a crap hole and a horrible place to work, and I will never do it again. Just don't cancel a contract. It makes you look bad. The agency gets pissed off. You may have to pay for that too. You may be fined or charged whatever the agency lost, and that can sometimes be a really big hit. So just stick with it. That's why I go back to pick a contract that you like, pick a contract that you want, spend a little bit more money on your housing, and make the whole situation bearable if it's already bad. So thank you so much for clicking on Travel Nursing with Trace. If you haven't already, please smash that subscribe button. It really helps me out. Thank you. Good health and happy travels.